Good evening, Doctor. Thank you very much for your time. Tell us first of all how the hospitals are doing. Are any full to capacity, or do you still have beds?
Yes. Currently, we've got about 918 patients. That was my last report yesterday. I could tell you how many people in each one of the different districts and in different hospitals. I think our biggest number is in the Nelson Mandela, where there's about 319 patients that have been admitted. And then the second big one is also in the PCM Metro, about 183. So I think what's important is that when the lockdown was done, that gave us time to build our capacities. We planned for 3,000 hospitals to take out of the hospital beds that we have. We've already retrieved around 2,000. We're planning about 8,000 field hospitals. We've already built just over 2,000 of those. So in terms of really capacities going forward, in terms of what we're going to be expecting, we've really geared ourselves for that. But what's really coming up is that patients need oxygen. And this is really what created the kind of surge capacity and challenges that we have. So we are now putting oxygen points in every one of the COVID, and that with the reticulation is actually ongoing. We think with that we'll actually overlay the difficulties of ICU beds together with the critical beds, and actually making sure that there are sufficient oxygen points in all our beds. That will make a huge difference.
And it sounds certainly like you've got a very clear plan, and you really have targeted in on the areas that you need. You say you need the oxygen, you need the ventilators. I just want to talk about the death rate, because it's second highest in the country after the Western Cape. And although, for example, Gauteng has 66,000 infections, and I think at least 40,000 of those are active, you have less infections, 38,000 infections, of which not all of those will be active, but you have higher deaths than in Gauteng. Now, what do you attribute that to? Is it because historically you've had a really fragile healthcare system, or do you think that you're not testing enough? What do you think the reason is for that?
Yeah, we actually have a death, what they call case fatality rate around 1.4%, and really the kind of general number, I think the national country is about 1.7. The general number is around 3%. What is really driving death amongst COVID patient positive is when you've got a higher infections amongst the elderly. If you are elderly, you've got comorbidities, hypertension, diabetes, and other chronic renal problems. Those are the patients that are actually doing badly. So when you look at the age, the patients that are actually passing on are the patients that are over 60, that have existing conditions, diabetes and hypertension. Those are the biggest ones. But we also find that most of our patients, especially in the private hospitals, we have actually have a much more higher levels of death as compared to the public hospitals. I think the key issue here is that the understanding and the bringing up of oxygen early, and also the bringing up of dexamethasone is going to change the condition and is going to reduce the number of deaths that we're seeing as we see today.
I understand that quite a few of the Cuban doctors were deployed to the Eastern Cape. What assistance are you getting nationally, and do you have enough support? Because I know that there's great concern that the Eastern Cape really does need to get a lot of support from around the country.
This is quite true. If you look at our epidemic, we're about a month behind Western Cape, and so the second issue is that most of our province have got a high density communities. What National has done is given us many of the people who understand how to manage outbreaks and how to deal with the issues of hotspots. And in the military, they've given us about 75 healthcare professionals. The majority of those are specialists, especially anesthetists. These are really important people that were going to be assisting us to reticulate, provide oxygen, train our team to put oxygen, to deal with the issues of the critical care and actually managing patients with respiratory problems. So we think that National's contribution is going to make. The Cubans have been helping us to deal with the epidemic in the district areas. Where we have got a hotspot, you need to know how to track, how to test, and how to isolate. And the Cubans are extremely useful into that. The 23 doctors that have been given with epidemiologists, data specialists, and all that. WHO has also put an end and has given us some of the higher-level specialists in terms of, modeling, forecasting, and data management. And we've got other support from the USAID in terms of ventilators. So we've got a lot of support, and we really appreciate it, and we need it. No one country can do this problem without really support. The issue for us is that the curve has been flattened. We have built many of the capacities, but we need to strengthen now the coordination of our effort and making sure that we're giving the best care for each one of our patients.
Absolutely. Well, good luck to you. It is not an easy time. Thank you very much for your time.